Will Miller, and welcome to The Other Side. Today we'll meet psychics who claim they can use their intuition to diagnose illnesses. Sounds pretty interesting, huh? Would you mind having an instant diagnosis?
No.
Sylvia, what are your feelings here?
Hip area. Funny because you don't look like you do, but your hips are rotated a little bit this way, which will put an extra pressure on your back. And this is in specifically the 4th, 5th disc area, running right up to the neck, to the C3, and even down into the rotator cuffs.
Ring a bell? You have some back problems?
Among other things, yeah.
Maybe they're growing. You never know. Well, psychic diagnosis, can we trust it? We'll find out today on The Other Side. Welcome back to The Other Side. The topic today is psychic diagnosis. With me now is psychic Sylvia Brown, and joining her are Sarah Wood and Janine Wiest, both of whom claim to have health problems. Sylvia, how do you tell what a person's health problem is?
Sometimes it takes a little while, but what you really try to do is start going down the body. Because one has chronic fatigue or Epstein-Barr, or Candida. One of them has that in their system. So I'm not sure if it's her or I'm picking up from her. Because usually, see, when I'm with a person, it's either direct on. Sideways is harder. I don't know why. Maybe it's because you take it on in the front chakras. But I'd be more apt to say there is a little bit of joint thing, anemia, but I still feel the terrible fatigue here. So it's like chronic fatigue she's got. Yeah.
Sarah, does that ring true?
In part, yes.
Okay.
Yes.
Sylvia, for $5. Look where we're going. What about Janine? Can you get anything? Do you need to touch Janine?
I would like to touch her. Something in the upper respiratory, something in the gland area, something in the sinus. Of course, we all have sinus now, so that's pretty benign too. But I really, really want you to get your chest, this upper chest checked, and the stomach area, right through this area. It's where you seem to be all through the system, and she's in this area. Mm-hmm. Yeah.
Does that ring true, Janine?
It's news to me.
Good news or bad news?
I don't know. I'll have to go to the doctor.
It's not bad. But I think what psychics should do more than anything is send them to the doctor about things that are beginning to develop.
Is this putting you on the spot?
Oh, no. I do this every day of my life.
But does it make a difference? Are you able to tell more in the quiet of an office?
Oh, sure. When you're sitting across from a person in the office and there's no other influences, that you're not picking up somebody's bad neck here and, and a problem over here that someome's having. Sure, it's easier, but...
I'm not saying that you believe you're 100% accurate all the time.
No,
you have
I don't.
Total confidence in that you have a psychic power that comes through you.
It comes from God, yes.
Okay.
Absolutely.
Well, joining us now also is Sarah and Janine's physician, Dr. Vicki Hufnagel. What do you make of this, Dr. Hufnagel?
Well, I think that there's an intuitiveness in looking at someone and trying to feel them. And I think when people watch Sarah or see her walk or look at her, there's a general feeling that you can get that this woman has some sort of overall problem. The thing is getting very specific. I don't think any psychic could figure out what Sarah really has, because it was so difficult that it took us 5 years to about 5 years to figure out.
And what is it?
Sarah will tell you. Sarah, tell them.
I had some silicone injected in my abdominal cavity.
Into her fallopian tube.
Quite a few years ago.
So you have like a poisoning of silicone?
Yeah.
She had silicone poisoning. It was a birth control device that they were experimenting with, and they experimented with over 3,000 women in this country. Oh. And she had silicone put all through her body, and as a result, the generalized problem.
Candida and Epstein-Barr type symptoms, and the chronic fatigue.
So that's pretty good. In other words, you read the symptoms accurately.
That's right. But you see, I'm not a doctor, and what I do resent, I would like to put a disclaimer here, I think there's a lot of psychics running around who try to take over the doctor's position. What I would do if she came to me would say, I see this tremendous fatigue and some disturbance here, and refer to a doctor.
Talk about Janine now.
Well, Janine is really quite healthy in her chest and upper areas. She's
no, she's not.
Well, it's my opinion, and I can have it. You can have yours. Her problem was specific, that she had a very severe endometriosis, which resulted in one tragic surgery and then we had to do a reparative surgery, and now she's a little tiger out there.
Yeah, but see, what I'm picking up is the upper lung area. See, you've already corrected this problem. You've done a great job on this. What I'm worried about is her upper lung area now. See, what I've done is I've jumped ahead of you. See, anybody who comes to me, and if they're all right, she's still dealing with this.
So you're predicting she's going to have some respiratory
Yeah, and I
problems.
want her to stop it before it starts.
How do you feel about that, hearing that?
That really surprises me because endometriosis is something that you always have.
Do you smoke?
I don't smoke. I've never smoked.
Do you have any lung problems at all?
No.
Any asthma in your family?
There's no asthma in my family, no.
Which was...
What helps to be able to make the diagnosis besides seeing them? Does age and name and background, is that any help in making
No,
it?
phone calls, I get phone calls, and I don't want to know their age or their time or whatever, because, you know, then they'd say, well, sure, at this age, you'd expect me to have, you know, arthritic or whatever.
How much of this is just a visual observation? You look at someone and you get a sense of what might the region of their
I
body...
never was really visually that close to her. They wouldn't let us get close to each other.
Do you feel her chest pains within you?
Yeah, I feel the pressure on her chest. At first I thought that I was going one over, but I feel the pressure in her chest. I wish I had a nickel for everybody that said no. In fact, I had a doctor come to me once, a female doctor, and I told her she had endometriosis. She said, no, I don't.
Yeah, but Sylvia, you're not 100% right, are you?
Oh, no, God is.
So you could be wrong here.
Oh, of course I could, but I'd like for her to get it checked.
Or watch it maybe 5 years down the
Yeah.
road. Is it a future thing?
Yeah,
Do you need
I'm
maybe a little,
life-threatening, but it's an allergy thing that it looks like it's almost a lactose bind up here.
A lactose bind-up? You really know medical terms, though, don't you? Lactose bind-up?
Well, I work with 91 doctors, MDs.
My question's for Sylvia. How did you become a psychic?
It's a long line. I mean, my grandmother was, and I was born this way, and my son, Christopher, is, and my granddaughter's showing signs now, and my uncle. It's a genetic fluke. I'm probably the most unlikely person to ever be a psychic in this world.
By looking at me, could you tell me exactly what could be wrong with me?
Yeah. I want you to get your gallbladder or bile tubes checked. Do you know where those are? Right on the right side under this area. I don't like it because you'll start having pain up your shoulder.
Do you?
Yeah.
Do you have digestion problem?
It's funny, you know, I've had 4 psychics that told me within the last 2 months to go and see a doctor. I finally went to my doctor this past Thursday, but he was an OBGYN, so he didn't absolutely check the gallbladder or anything
No,
like
he should have, though. Go to her. She'll do it.
But in looking at you, you're typical for, just looking at you, you're typical for gallbladder problems.
No, she's not blonde, blue-eyed, and 40.
No, but she's overweight
That could be
and
thyroid.
black, which
That
is
could be
high.
thyroid.
But see, this is part of the thing, is that medical things allow you to classify.
But see, I'm
you're
not
both
medical.
Oh, but you are, maybe, more than you know.
Well, it's psychically medical. Because my whole background is in English literature. That does not lead itself to...
But your language and your knowledge is quite good, I think.
But I think that's infusion.
Well, that's
Infusion?
fine.
You're having actually a technical conversation that none of us have any idea what you're talking about.
We don't want you to listen to us. We're
We
having...
have identical twin psychics who work together to find out what ails you, so don't go away.
When the other side continues.
Welcome back to The Other Side. Joining me now are identical twins, Linda and Terry Jameson, who will attempt to diagnose Karen Frakes. Thank you for joining us. What methods do you use to diagnose somebody?
Well, Terry and I are clairvoyant and also clairsentient, where we have a feeling, a sensation of where something might be blocked in the body. There could be a potential problem or already a problem. We also use diagrams. We actually find the location on the body, and it's natural. We circle it quite naturally. And also we use automatic writing, which is a technique a lot of psychics use. It's a tool where the writing just sort of flows. It's very even and fluid.
What do you think is troubling Karen?
Well, the first sensation that I got was something around the lower abdominal area, the colon area. I'm sensing there is a block in your colon, and therefore that can create problems such as allergies. I sense you have a liver toxicity, which would be very helpful to start doing a sort of a liver cleanse or a purge. I'm feeling also a rage or a hurt from childhood that you're holding, and this can manifest in a lower abdominal kind of pain. Do you sense this also?
Yes, I do. I feel there is a colon, something in the energy of the colon, perhaps leading to an illness. I feel like you just had the flu recently. Is that possible? Did you just get over a cold? No. I sense that maybe there's something going on with bronchial, with allergies perhaps, a history of hay fever, something like that, and also something in the bladder area, possibly bladder infections, a tendency towards a kidney and bladder weakness that might be diet related, and also I sense an emotional link to that. I agree with you. I think there's something like fear that you might investigate therapy, which I think could actually help your whatever method of healing you're pursuing right now with a doctor. That and diet, I think, could both contribute greatly to the healing process.
Karen, what's your response to this? Are they?
Well, the one thing that you mentioned, I do have allergies from time to time, definitely.
What about the other, the lower abdomen, the colon area? And the other things they said, did it ring true?
Not the specific things they mentioned, no.
Dr. Hufnagel, what do you think about what it said?
Karen, you want to stand up? Karen's carrying a soccer ball-sized tumor in her uterus that hasn't, and we'll have her surgery shortly, and it's in the uterus, and it has not affected the kidneys or the bowel yet. And it's benign, not causing her, any other symptoms, but
thank God.
Doesn't need to be there.
Bad enough having it, but at least
and she's so beautiful and carries it so well. But it's like being pregnant all the time, and we'll be taking that tumor out.
Wow, best of luck. They signaled the region.
The area certainly is correct. It's in the abdominal area.
Is this where sometimes it gets difficult that you perhaps have good accuracy with the region of difficulty, but then trying to get very specific is where it gets a little dicier for you?
It's harder to be specific, but I think in a different setting when you're with one person in your home, say, it's a lot easier for us to be specific. But I think just to get that area and to pick up that there is some fear related and a lot of frustration.
If you just did enough, but say to them, go to the doctor and get your abdominal cavity checked would be enough.
But the point on the fear, I think, is important because I think that most women who would have a tumor in their reproductive areas are going to have some level of fear.
You'd be terrified.
Terrified.
I've had a medical problem, supposedly fairly serious for about the last year and a half. And I've been given several diagnoses, but the final diagnosis was something that all the medications and everything they've put me through just haven't worked. And it flares up on me about every other day. To the twins or to Sylvia, can you look at me and figure out just exactly what it is that's going on inside my body?
First of all, have you been on any prednisone?
Yes.
Yeah.
Prednisone?
Yeah. Have you, it's a steroidal. Have you also been on an anti-inflammatory recently?
Yes, I'm on one right now.
Yeah, because it seems like you've been on either naproxen or something of that nature. This has flared up your stomach. I am sure you probably had 2 or 3 diagnoses. And see, please, you come in and help me here. Have you ever been diagnosed, or they said anything about lupus?
Yes.
Yeah.
You don't know Sylvia?
Of course not.
Sylvia, you don't know this woman?
Oh, no.
That's a good one.
Thank you.
She has the facies and the change in her neck and shoulders which fit with the cortisone.
You have lupus?
They've mentioned it and they've tested me for it, but so far it's come up negative.
Because that's isn't lupus extremely hard to diagnose even in hospitals?
Do you have any silicon in your body?
Linda and Terry, what's your reaction?
I don't think she has lupus. We've been diagnosed with lupus too.
A lot of women.
My feeling is that she has an extreme autoimmune system breakdown. The steroids are probably actually contributing to that. I would really,
but see, the reason why she started taking it in the first place was breathing, stomach, and everything else. So she started getting into a bind-up. You see what I mean? She started rolling into this.
So she needs then, therefore, the advice you give, you have a strong sensation about some problem. She needs to continue pursuing with doctors testing.
Or change doctors.
Well, I've been through 11 doctors now.
Maybe you ought to go to her.
Nobody...
Go to Dr. Huffnagel.
She doesn't screw around with people. She just tells them.
It's true.
I know. I'm psychic.
Linda and Terry, how did you get into this kind of work?
When we were in our teens, we started to get sick, and by the time we were in college, we had trouble walking. We had crippling pain all over our bodies. Throughout our 20s and 30s, it continued over 20 years of pain, and an army of doctors literally threw up their hands and gave up on us. So we had to become psychic to stay alive. It was kind of a life or death thing. And we started seeing psychics actually as a last resort. And they were the only ones that were able to help us.
And what did they do? What was their advice finally? Did they help lead you in the right direction for diagnosis?
It changed, our whole life changed.
And what was it? What was the problem?
Okay, well, it's actually a combination of things. It's something called,
fibromyalgia coupled with lupus-like symptoms. Also, we've been thought to have mercury poisoning.
Were you ever diagnosed to have like rheumatic fever?
Never.
No.
That was one of
that's just the hit I got immediately, was to take on all the symptoms of having rheumatic fever, which we don't see that much of now.
But your experience came out of your own health crisis. Well, when we return, we'll meet a psychic who diagnoses people by the color of their aura. Welcome back to The Other Side. Joining us now is psychic Shelley Hochberg, who will try and find out what's wrong with patients Lisa Napo and Alex Prince. How do you determine, Shelley, if someone has health problems?
I determine for the aura. I'm able to feel, I'm clairsentient, so I can basically, what I do is I scan the body. I'm able to feel an area where there may be problems on the body.
Is that more than me just being, say, an intuitive person who's...
It is intuitive. It's being able to be... Clairsentient is a person who's intuitive and can impact.
But it's more than that. I mean, I can't do this. It's more than what I could do.
Yeah, it's being able to feel by scanning the body, the energy body, that's the aura, and I'm able to see colors around the body.
What's wrong with Lisa?
Okay, dear, I want you to relax. With Lisa, what I'm basically sensing is depression over her physical condition, something with the female reproductive system, concerns about having children. I feel that's very important to her. Lisa, is any of that accurate?
That's part of it.
Okay, that is part of it. It has to do with a female problem?
Yes.
Okay, it's in the lower part of your body?
Yes.
Anything with either the ovaries or the fallopian tubes or the uterus?
Not that I know of.
Okay.
No.
You need to have that checked out.
Okay.
Also, I was sensing some type of... Are you prone to infections? Because I keep seeing some type of infection that keeps coming back.
Infection. You're prone to infections?
No.
All right. That's basically all I'm sensing with you.
This is Alex.
Alex. Alex, are you on any medication for your blood pressure?
Yes.
Okay. And anything with either heart, lungs, or gallbladder?
Yes.
Which one is it, dear?
Heart.
Heart. The other thing that I'm sensing is surgery. Has there been a surgery, or are you discussing with your doctor the possibility of surgery, something with the valve of your heart?
Already had the surgery.
Oh, you did?
Yes.
Good. All right, thank you, sir.
Lisa, what do you think about what you heard?
That's part of what's wrong.
What else is wrong?
I have migraine headaches.
Alex, what about you? What did you think about what you heard?
Very good. Hit it pretty nail right on the head.
Thank you.
It is. What's ailing you? Tell us, describe what's ailing you.
Well, I had bypass surgery and two-way bypass in the heart, and I'm taking medication for it now because I had it 18 years ago and it's starting to reoccur again.
And the blood pressure?
Blood pressure is, I have medication for that also, and it's doing fine.
Okay. Well, joining us now is Lisa and Alex's physician, Dr. Flaterman. Doc, stand up here. What did you think about what Shelley just shared with? These are your patients.
Well, in Lisa's case, her main problem is that of migraine headaches.
Migraine headaches, that's the principal problem.
The principal problem. And she's a young, over-concerned lady, but I don't think she's prone to infections.
What about the female problems that he was talking about?
Well, she had it in the past, but she doesn't have it now.
But there was some sense that there was some history of it.
Yes, she may have had a few months ago, she did have an infection.
What about Alex, what you heard about her say about Alex?
Basically, it's true, you know, but he has many other things which I don't think that they even touched so far as the diagnosis.
Like what?
Well, he unfortunately had a blood transfusion that caused liver disease, and at this time is one of the main problems that he's facing.
Alex. Are you okay? I mean, is he going to be okay?
He will be okay.
Good, because he's in good hands.
Exactly.
Yeah, exactly. Good. Let me ask you, do you scare people sometimes? In other words, you know, Lisa, you came here with migraines, and then someone says, man, you may have some female problems, some other stuff about having children. Doesn't that scare you to death?
Definitely. Yes.
What do you say to that?
I wouldn't have said that.
Yeah, but, you know, you might have said something else that might have scared her too, though, Sylvia.
I don't think so. I think a psychic should know when they know their client well enough to know when they scare them or not, or at least reaffirm or tell them what it actually is. Like
stuff you said before scared people. I mean, it would scare me.
Well, sure, but if you really knew to go to a doctor and you referred to a doctor and I said it was going to be okay ultimately, yeah.
What about that, Terry? I mean, you know, the issue of fear, scaring people. Is
I think it's true. You have to use sensitivity. Of course,
and know
this is on the spot. Everybody's on the hot seat.
Everybody's hard.
But absolutely, you need to use sensitivity in terms of, we don't tell somebody if something bad is going to happen, when they're going to die. I mean, we know, but we don't tell.
In other words, before, even though what you did before was accurate that you picked out a region. Well, suppose that woman had said that wasn't the region, and you were feeling something that she didn't have. You would have scared her, too.
Well, it's possible, but they should know. I mean,
well, shouldn't it be better that we scare them a little bit and go to a doctor and find out that they could prevent something than to have them
aware? This question is for Shelley. What do you do if you sense somebody has a medical problem?
I always advise them to go to their physician and to definitely
arm them with what perhaps to look for.
Yes.
This question is also for Shelley. How long have you been a professional psychic?
I have been reading since I was 16 years old. I've been doing it professionally for about 8 or 9 years.
Yes, this question is for Sylvia. And I would like to know if there's something detrimentally wrong with me that I actually need to go to the doctor as in right now.
I think everyone should go to the doctor for a checkup. Yeah. But do I see anything really malignantly or toxic wrong with you? No. But I would, you're one of those people that really has to watch your pancreatic area because you dip into either high or low blood sugar. You kind of spike funny. So I would go and get that checked.
Yeah.
Your blood sugar issues?
Oh, I don't know about the blood sugar issue, but I do have sometimes pancreas problems.
Well, that's in the blood sugar, honey. That's in the Isle of Lanarhans. That's where it is.
When we return, we'll meet one of the top psychics from down under who says that 8 spirit guides help her zero in on our aches and pains when we come back. Welcome back to the other side. Joining us now is Australian psychic Suzanne Miles. Our panel of psychics will try and intuitively diagnose Heidi Elowich. Suzanne, how do you determine if someone has a problem?
I scan through the body and then I'm told when to stop, and it's usually in an energy way or a feeling way. Sometimes I actually hear voices telling me what's wrong and where to stop in the body.
And once again, though, it's in the region of the body. You begin by feeling where the region of problem is in the body.
That's how it actually starts, and then sometimes I'm actually able to see into the body at the actual organ and see what's wrong with it. Not being a medical doctor, I can't put a name to it, but I can say, well, it's in that thing that's shaped like that, and that's what it looks like.
Now, what about Heidi here? What do you feel about Heidi?
Right, I feel with Heidi that there's quite a lot of energy blockage going right through the body, particularly right down through the centre. I was directed to stop around the throat area. Now, this could be that she finds it difficult to express herself, or it could in fact be a medical problem. Then I came down around the chest area and it got quite dark, as in showing me that I should stop again. And I do feel respiratory troubles here, more sort of like bronchial asthmatic. Then as I went down even further, I was shown her spine, and I feel that she has trouble with her spine, like either a slip disc or her hip's a little bit out of alignment, something like this. But the thing that I kept seeing, and I have to verify this, I kept seeing a colostomy bag. Now, I realise that that's pretty heavy to say to Heidi, but she either has problems down there or a female member in her family has got the potential of being on a colostomy bag.
Heidi, what do you make of all this?
Very on target, most of it. I do have respiratory problems. I have asthma, and I do have some problems with my throat from a hyperacidity problem, acid reflux, and esophageal problems. And I have some pain in the lower back, but I don't know that I have, slip disc or anything like that. And as far as the colostomy, I do not have a colostomy bag, but I have Crohn's disease, which is an intestinal disorder.
Well, Suzanne, it sounds like you were pretty accurate about that. Before you say more, what are the others think? Sylvia, what do you think?
I was going to say like diverticulitis ileonitis. Yeah.
What is that?
It's an inflammation in the lower intestinal tract, but I don't see her with a colostomy bag.
Linda, Terry?
I also got a feeling of intestinal inflammation, and I couldn't decide exactly where, but also liver, all very related, kidney and liver related.
Yeah, I had circled the midsection, the digestive area.
Okay. Shelley, what do you pick up?
I felt bacterial infection, and I felt something around kidneys, lower spine, where the kidneys are connected.
Heidi, does that make sense? They all seem to be unanimous in this lower area.
It's surprisingly on target. I don't know that I have any liver or kidney problems, but definitely intestinal inflammation is part of my illness, yes.
You have a pretty complicated medical situation,
you could say that.
You have anything else? What do you have?
Migraine headaches.
Migraine headaches? None of you? That's interesting. Now, you're the second person or third I've heard today say migraine, but I've never heard anyone talk about anything in the head. Yeah, what else?
May I comment on that?
Yeah.
Usually with migraines, unless you've actually got one or just had one, you're not going to pick it up, whereas the other things are permanent or, semi-permanent, so you tune into that.
Yeah. And Heidi, what were we going to say? What else?
I also have fibromyalgia.
Fibro what?
Fibromyalgia, like they do.
Fibromyalgia.
I'd like to ask the lady from Australia, who are these 8 spirits that you talked
Well, from what I've been shown, they were doctors passed over from different generations, and they appear to me quite differently depending on the work that I'm doing. I don't see a panel of 8 all the time, but over a period of time I've had 8 different people come to me. When I've asked them their profession, they've told me that they've been a doctor of some form or another. Unfortunately, my difficulty is in being able to decipher the accurate words that they're using. You see, I have to bring my vibration up, they bring their vibration down, and somewhere in the middle we meet. So unless I'm really in top-notch form, there can be a lack of interpretation, so that you need to be very careful the words you use, not having any medical background at all.
So the source of your psychic power are these 8 passed over physicians who guide you?
That started about 15 years ago.
What is fibromyalgia?
It's a rheumatic disorder. It's very similar to arthritis, only it affects the soft tissues, muscles, joints, tendons, ligaments.
Man. Are you okay?
So-so.
So-so.
Yeah.
Are these obviously injure the quality of your life? Are they life-threatening?
Not life-threatening, but they definitely affect the quality of life.
If you're a psychic and you had another ailment, would you guys be able to do a psychic reading on seeing how another, if someone had brain surgery, would you be able to tell if they had brain surgery or had another ailment on top of that?
Oh, it depends. It depends on what is the most critical thing. I can only speak for myself, but I think these girls will go along with me that we usually pick out the most critical thing or the thing we think we can help with the most at that particular time.
In all these cases, in all these cases, you have, noticed several things.
Mm-hmm. I noticed that you can analyze everybody else. Can you analyze yourself? The whole panel?
No. If you lost your billfold, I could find it. If I lost my billfold, it's gone.
Well, that's a bummer, isn't it?
It is a bummer. But it's sort of like the shoemaker's kids never have shoes. You know what I'm saying? You can't.
Yeah, but you can't intuit.
Sometimes. But I mean, I think we go out so much this way that we're never in this way, and that's why we have to go to somebody, a doctor, and they have to tell us what's wrong with us.
Yeah, but can a psychic do another psychic?
Yes. Yes. Oh, sure we can. Sure.
Do you give? Professional courtesy?
Oh, of course we do.
Yeah, we do swaps.
We do swaps.
This
all
is
kinds
for Sylvia.
of things.
Sylvia?
Can you diagnose my situation?
Pardon me?
Can you tell me what my problem
I'm
is?
really concerned about your adrenal area. Have you had your adrenal looked at?
No.
I would have your adrenal looked at, and also, here we go again, with the pancreatic area.
It's a bad year for pancreas, isn't it?
It's a big deal for pancreas. Well, of course, she had low blood sugar. Of course, she doesn't know that because she just doesn't know it's in the pancreas. And joints.
Anyone else got any feelings?
I have a strong feeling about your thyroid, a weakness in your thyroid area, your thyroid gland.
Yes, I'm picking up a lot of dark area down both sides of the neck here and along the shoulders to about here. It's quite heavy and quite dark, so that would go from one side of the body to the other.
Does that ring a bell?
No.
What's ailing you?
I'm a candidate for a knee replacement.
Well, isn't that a part of your thyroid? Isn't that a...
No, that's arthritis, knee. Maybe you can't see it.
Yeah.
It's not the pancreas. What I'm picking up is this lady's got a dark spot right across there. I would say it's more stress related.
Isn't that in some ways, and I know as a therapist sometimes we can sort of create a box for you to say, well, I think this is troubling, and if you say it, I'll just say, well, you're in denial,
No,
you can't do that.
I think this lady's got a lot of stress problems.
When we come back, Sylvia Browne will do some readings of some members of our audience. Stay with us. To the other side. We're going to let Sylvia Browne go into the audience and see what she finds out. Come on, Sylvia. Who are we going to look at here? How about this lady here? Why don't you stand up?
Anemic. She has some anemia. She also has some problem with, could be sinus, but her ears. And this could cause dizziness. You know what I'm saying? A vertigo. So
She's
really,
right? What problems do you have with
I can't ice skate and turn around.
Oh, she's like this.
That kind of. If I walk in a room with a strobe light, I fall over.
Vertigo.
How do you feel that? How do you know that?
I'm close to her. It's easier when I'm close to them. I can feel it. It's an inner ear thing. Go to an ear, eye, nose, and throat doctor. They'll take care of it. There's wonderful things out now. Antivert and, all kinds of antihistamines and things that will really help you.
Great. Okay. Good. How about this lady right here? Stand up.
She's in pretty good shape. She has a she's got a real determination to be in good shape. And she's vehemently opposed of anything that's stubborn. Now she can have a problem with her thyroid. There is no doubt about that, and her thyroid. And I want her to make sure that you get it checked because I don't want her to get into the Graves illness. Graves, yeah.
Does that ring a bell?
It's in my family.
Yeah, and I don't want her to hereditarily come down with it. Yeah.
Now, you seem very calm. I mean, someone walks up and says that. I mean, doesn't that shock you?
Well, I've already been aware of it because it is in my family, but it hasn't been, it hasn't flared up with me yet.
Yeah, but a lady comes out here.
I've been checked for it, though.
Yeah, but it's real.
You should keep being checked for it because the sooner you get on something, whether it's Synthroid or whatever it is, with your doctor, the better off you're going to be.
Great.
Thank you.
Don't mess with Sylvia. Well, put it up there.
This lady looks fragile and small. She's tough. It's like the other one's stubborn. I'm not too thrilled about C3 here. You know what C3 here is? That's right at the, and it's almost what we call the whiplash, what I call the whiplash injury area.
Your back,
and,
isn't it? Yeah.
No, it's right in her cervical area, C3.
This is accurate?
Yeah, I was in a car accident.
Yeah, and it's a thing.
And you broke your C3?
No, I've been going. I had a whiplash, and I've been going to the chiropractor.
That's what I just said.
I'm sorry for doubting you. I'm doubting you. I mean, yeah.
But it's pretty good. But I don't like the fact that now it's traveling up this way and it's going down this way a little bit. But she's got it pretty well under control.
Okay.
Thank you. Great. Hip joint. A little bit. Let's see. I'm right. Right. You've got to watch out for your right hip joint, your right knee. Everything's on your right side for some reason. Right area here in your shoulder. Rotator cuff, right hip. You're in pretty good shape, though, kid. You really are.
Does that ring a bell, though? You have any problems on your right
Most
side?
of it is in my head, my migraines. I have a lot of migraines.
We have a lot of
all the time.
migraines, and you know, I really think that these people really ought to go to allergy doctors for this.
Yeah.
There's a lot
There's
of
also
allergies.
enormous stress. I mean, a high percentage
Well,
of people...
you know, but we've proven pretty well medically, at least the doctors that I work with, and I started picking this up 30 years ago. Chocolate is a big suspect. Dairy's a big suspect now. Since she loves chocolate, she likes it. I know you do.
Okay. How about a man? Let's get a man. How about this gentleman? Stand up, sir.
Very sensitive feet. Not that that's a health problem, but your feet are sensitive.
Is that right? You have sensitive feet?
Actually, no. They're pretty calloused over. But I don't like people tickling them.
You're calloused over feet.
Yeah, but I mean, what I'm saying is they're very...
sensitive.
Oh, yeah, they're sensitive to everything. Do you have a deviated septum?
I did.
Yeah, so you had it taken care of.
Yeah.
Thank God, because it looks like it was really giving you a terrible... Plugged up here, all sinuses, thick across.
I was at a very bad case of my sinuses were completely closed off.
Yeah, but that was the deviated septum was actually went this way.
Yeah,
Yeah.
it did.
Interesting. This lady, you're begging. Come on, stand up. Now, don't shrink back now. You've been wanting this. Go ahead.
Should have quit while I was ahead.
Bladder. She has to watch out a little bit for her bladder. It's very common. As the good doctor will tell you, we women have a problem with prolapsed bladder, sometimes after 30. So make sure, pressure will start. Go see a doctor. I would say that anyway. But notice that you get a pressure. You keep having to go to the bathroom at certain times. You see what I'm saying? More pressure and it prolapses. Yeah.
Does that ring a bell? Is this something that might be coming on her?
No, I think she has it now. She just thinks everybody goes to the bathroom that much.
Yeah,
And it's not true. We don't go to the bathroom, every 30 minutes or whatever.
Now, does that scare you to hear that?
No, prolapse bladders. And talk to the doctor about it. It's no biggie. Do Kegels.
Kegels?
Well, we don't get
What do you mean do Kegels? What's that?
It's another show. It's another show.
Okay, so
How do you feel about that?
I have to go to the bathroom.
Yeah.
Man, crazy, huh? Unbelievable. How about this lady up here?
You know what's strange about this? I feel that this woman had a scare, but she's come out of a scare. I think that if you had some problem recently with the breast, well, I'd get your right breast checked. Not because I think it's so terrible. I just don't want you to be scared by it. Okay. Under the arm, the right breast.
Any of that in your family?
No.
No.
But she's been under a lot of stress. Oh, haven't we all? No, but I mean, there's a young male that seems to be causing a lot of stress. There's an older male that's causing a stress, and a short woman that's causing stress. You got
ring a bell?
Oh my God.
Is this right?
Yes, my mother yesterday.
Your mother, is she the short woman?
She's the short woman.
Yeah. And who's the young man?
She just flipped out.
Yes.
Yeah.
Really?
Yesterday.
Yeah.
And my son was with me right now, so it's like,
And your mother just
But you see, we have to address the whole issue. I'm sure the doctor down here would tell you this, or the doctor over here. Don't we have to address the whole issue? We have to address the soul, the mind, the body. Otherwise, we're just, what are we, mechanics or what?
Well, you know what? A lot of people expect medicine to be more like mechanics.
Well,
right?
and good doctors like these doctors that you've brought on aren't. They have addressed the whole social and spiritual and physiological. And
we only deal in the best here. So
I know that. I know that. It's a right up.
One more.
Show.
How about doing one more right over here? Stand up, sir. Now, what could possibly be wrong with this guy?
Well, not much, but he's prone to ulcers. He's a little bit prone to upper ulcers. He doesn't have it now, but he worries about everything. He's the type that could worry about worrying.
Right?
He worries about going to the gym, whether he's going to go to the gym, his friends. He worries about them going to the gym. He worries about cars, a job. He worries about everything.
Is that true? You a worrier?
Oh, yeah, that's right. That's right on. Yeah. Worrying about everything.
Oh, we all worry, but I mean, he actually worries about worrying.
You're a professional worrier.
Professional. Yeah.
Now, that
don't get paid for it, but
yeah. But that kind of worrying can cause a whole lot of
genetically
difficulties.
predisposed to this, so I don't worry so much about. You know what I worry about is the people who never, and then they have it, and they drop over like that.
Yeah. So what do you need to do? Stop worrying.
Well, take a deep breath and put yourself. Do
some meditation.
Stop.
Relax.
Yeah. Stop. Ask the white light of the Holy Spirit to come around you and just stop.
Okay. Well, relax now. Okay, thanks. Good. We'll be right back. We've seen a pretty impressive display of medical diagnoses by 5 different psychics who all had the same message. If you suspect something is wrong, go see your doctor. Thanks for joining us on The Other Side. Here's a preview of our next show.
Words from beyond the grave.
And I always felt like she needed to tell me something, and she started writing to me.
Voices from the other side.
It's a very comforting message that can change our life.
Departed souls trying desperately to communicate with the living.
And I knew it was my mom.
Is this the voice of a psychic?
It was 14 years ago that John Lennon was murdered outside his home in New York City. His music spoke to millions. With us today are people who say John still speaks with them from the spirit world. The life and afterlife of John Lennon, today on The Other Side.
When The Other Side continues, find out how tarot cards influenced John Lennon's final days.